All right, good evening. Welcome to another session for pharmaceutical marketing and entrepreneurship. So, this will be our third session, and the topic outlined for our third session will be under the Unit 2, the healthcare business in the Philippines. So, for our third session, these are our topic outlines and the objectives or intended learning outcomes that is expected from you by the end of the session. So for the first outline, we are going to define the term marketing. This will be the focus of our session. And after this, we will be able to really appreciate the definition of the term marketing. It will be able to analyze or first identify the core concepts in the term marketing. Once we were able to um, identify the core concepts in marketing, we will be also encountering the terms needs and wants. And also part of the session is we will be able to differentiate the needs and wants. And lastly, before we end our session, you will be applying the reading materials or the content of the reading materials that was assigned from you last session. As a review, those are the National Drug Policy or the Philippine National Drug Policy. I hope you now know their pillars and also the Republic Act 6675 or the Generics Act. So before we end this session, I would like you to assess how does, for example, only these two government regulations affect the concepts in marketing, which we will be discussing at the start of this session. So if you're ready, let's start with the first one. What is marketing? So I know you've heard the term marketing several times now. You've heard this from televisions, from your friends, or anywhere. This is a very uh, common term. This is widely used by the people in the community. So technically, how do we really define marketing? So before we define this term, let's ask first ourselves, um, does marketing always involve selling? Do you agree? Mhm. Because we've heard the term marketing several, uh, most of the time when we are going to buy something or something is being sold to us, so there will be a concept in our mind that once we talk about marketing, there is always it always involves selling. So we'll answer this question later as we progress in our session. Now, the next question I want you to ask yourself is, how can a person become a marketer? So, paano nga tayo magtawag na marketer? How can a person become a marketer? How can you not become a marketer? What are the different situations that a person can be considered as a marketer? So in this session, you will also be able to identify different situations or different factors that determines whether the person is a marketer or not. Now, I think one of the most questions we need to ask ourselves, why are all pharmacists marketers? Before this, I want you to ask yourself first if you agree on this, especially for the term on. Do you agree that all pharmacists are marketers? If yes, why are all pharmacists marketers? Right? I think in order for us to really appreciate the definition of the term marketing, we need to um, deduce first or identify first the core concepts of marketing. So let's go. So in order for us to fully appreciate the definition of the term marketing, let us identify first the concepts behind marketing. And aside from identifying these concepts, we also like to determine or investigate their relationship from each other. So to start, let us first talk about the concept needs in one, the needs in one concept. As part of our topic outline and also our intended learning outcome for this session, we are also going to differentiate the term needs and wants. So before we proceed to the other, what you call this one, other concepts, let us first differentiate the term needs and wants. So quite simply, the economic definition of need is something needed to survive. Two people could argue for hours about whether a given product or a service is new. Obviously, circumstance and frames of reference are important in this discussion. What one person needs, another person wants. Also, there are a variety of ways to meet need or a want. For example, we all need to eat, but does that mean that we need to eat a, let's say, mga mahal na pagkain? Filet mignon with, filet mignon if you've been watching MasterChef or other expensive food, pizza. Is it expensive? I don't know. I'm not rich. I don't know what are the expensive foods. For example, let's use filet mignon. So, but for example, we all need to eat. That is a need. Eating is a need. But does that mean that we need to eat a filet mignon with a fresh steamed vegetables and a nice glass of white wine? Well, at first glance, it's easy to assume the difference between wants and needs when you really start getting into it. The differences can be difficult to articulate. Quite simply, the economic, again, definition of need is something that needed to survive, like eating. In marketing, the idea of survive is real, meaning someone would die without their needs being met. This includes things like food, water, and shelter. On the other hand, wants in marketing is one step up in the order from needs, and is simply something that people desire. Take note of the word desire. It's something that people desire to have that they may or may not be able to obtain. So, knowing the needs and wants of our second concept, the people, right? This would be the first concept, the needs and wants. And the second concept, the people. So, in marketing, we are going to satisfy the needs and the wants of the people. We are going to address these needs and wants. How? The question is how. How can we agree? Sorry. How can we address the needs and the wants of the people? The answer for the question how is through the products or services. So we will be able to address the needs and the wants of the people through products or services. And this can be done through an exchange process, the satisfying the needs and wants of the people through the products or services can only be completed through a certain process we call the exchange process. What is being exchanged? So these certain products or services that satisfies the needs and wants of people comes with a cost and value. So I guess by knowing these concepts, the needs and wants, the people, the products or services, the process of exchange, and the cost and value, by knowing these five core concepts of marketing and knowing their relationships, you'll be able to make your own definition of what marketing really is. So, as a review, marketing is a process of satisfying the needs or wants of the consumers through a services, through, no, not what I services, so through services or products in exchange of a value or cost. So going back to the definition, or going back to the core concepts of marketing, in the definition of the term marketing, you'll be able to identify the five core concepts. Number one, this is the first concept to identify the needs and the wants. The second, the people or the consumers or the customers. The third one is a exchange, the process, right? The fourth one, this one, yeah, this is the third one, sorry. The third one is the services and products. The fourth one is the process exchange. And the last one is the value or cost. So again, marketing is a process of satisfying. Take note of the word satisfying. What are you going to satisfy? The needs or wants of the people, specifically the consumers, through services or products. So it can be done through an exchange process. So there will be an exchange of services or products and value and cost. So going back to the questions that we asked ourselves a while ago in previous slides, does marketing always involves selling? The answer is no. Why? Why no? Because going back to the definition of marketing, it is a satisfaction of the needs and the wants of the people through a product or services in exchange of value or cost. For us to really, um, what do you call this one, appreciate the answer to this question, let us give a scenario. For example, um, a teacher in the pharmacist, pharmacist, pharmacist who is in the academy, um, teaches the students, and that teacher or that pharmacist in the academy is still considered a marketer. There is no selling involved in teaching, but still the teacher or the pharmacist who is in the academy is still considered a marketer. Why? Because let's put this into place. Um, the teacher teaches the student, right? The teacher teaches the student learns, in exchange, the students pays tuition or the salary of the teacher. So as you're going to um, identify the concept of marketing involved in the situation, the teacher and the students are the consumers. The students needs and wants, they need to learn, they want to learn. So the teacher teaches the students, the teacher goes to the class, teaches the students, those are the services. So once the teacher teaches the students, it can satisfy the need of the students or the wants of the students to learn. And this involves an exchange process by the students paying the tuition for the salary of the teachers, and this tuition is the value or the cost. So I hope you'll be able to understand now that marketing does not always involve selling. The next question is, how can a person become a marketer? Any of us can become a marketer. You, your mother, your ex, your future lover. Any one of us can be a marketer as long as we know how to satisfy the needs and the wants of a person. We know how to give products, or we know how to give services to them, and we know how to receive, or we know how to function in the exchange process of receiving also in return the cost or value of our services. So the next question that we are going to uh, answer again is, why are all pharmacists marketers? First of all pharmacists are marketers, right? This can be supported by our discussion on this question. All pharmacists are marketers because we satisfy the needs and the wants of our patient, and then we satisfy them by our services, our pharmaceutical services. Once we satisfy them from our services, we also receive um, the in the process of exchange, the result of the exchange process, we also receive our salary. So basically, we give pharmaceutical care as a form of service to satisfy the needs of the patients with exchange salary in return. Right? So all pharmacists, no matter what field you are practicing, hospital, community, um, research, and drug development, you are all considered as marketers. Now, let's go to our last topic outline. We now discuss the five concepts of marketing. We defined already the marketing as a process of satisfying the needs and the wants of the people through giving them the products or services in exchange for value and cost. By this, we also differentiate the term needs and wants, where needs are more of what the people have to obtain in order for them to survive, while want are not merely is an upper order of their need. Now let's go to the National Drug Policy of the Republic Act 1995. I want you to assess uh, the relationship of these concepts to those of these two given or two government regulations. How, based on your understanding of what you've read from reading materials, how does the Philippine National Drug Policy affects either one of these concepts or all of these concepts? How can the NDP influence exchange? How can NDP influence people, needs and wants, etc.? Or how can NDP influence the entire marketing concept? The same to Republic Act 6675 or the Genetics Act 6675. So by this, I hope you have understood the um, the topic outlines and were able to achieve the intended learning outcomes. Again, I hope you'll be able to define the term marketing, identify the different concepts of marketing, um, differentiate the term needs and wants, and also assess the Republic Act 6675 and NDP, assess how can they affect the concepts in marketing or the entire marketing concept. So once again, if you have questions, just feel free to ask me. Don't hesitate to approach me. Thank you for listening and good